So tell us about such a key initiative you have taken. How does it impact India and some of the salient feature about this?
Poshan Abhiyan was very much needed in the country. If you know, as per NFHS 4 in 2015-16, 38.4% children are stunted in the country. And if we have to harness the demographic dividend of the country, we have to ensure children are tall, strong, healthy and not anemic. To bring the synergy between the efforts of Women Child Ministry and Health Ministry, Drinking Water and other about 10 more ministries, this Poshan Abhiyan was conceived and approved in November 17 by the Union Cabinet. And thereafter, I think Honorable Prime Minister launched it on 8th March of 18th from Jhunjhunu. This brings into the synergy of all the schemes and programs, and it goes to the grassroots level. And we have put a mobile app, ICDS Common Application Software, which does real-time tracking of the service delivery. It's a service delivery tool of which monitoring is a byproduct. It has an inbuilt content of predictive analysis. It has a big data. And it also uses artificial intelligence in some manner.
Such a key initiative, and you have been at the helm of the affair from the day first. What has been the reach and scale of your program so far? How much it has impacted? Can you talk about the impact and reach of
the Anganwadi centers? There are 1.4 million, 14 lakh Anganwadi centers in this country, and as on date, I am told more than 5 lakh Anganwadi workers are using smartphone and the mobile application, ICDS Common Application Software. It has percolated down to everybody. And here there is an auto plotting of growth chart, automatic measurement of growth, counseling videos embedded, the quality of counseling on breastfeeding and complementary feeding, institutional delivery, immunization, everything is so good. And we have also built in the platform for capacity building of field functionaries in a very, very slow manner. We call incremental learning approach. There are 21 modules. So slowly you learn one module. So it becomes a habit for them to do. This tool also has got a due list. The moment you open your smartphone in the morning, you will know that these many houses I have to visit, these many children have to begin vaccine, these are children who are coming for feeding. If you are feeding children also 3 to 6 years, yes, every day a picture is taken. It's geotagged, so we will know that how many days in a month you have actually fed the children. So that's a very robust service delivery tool. Iron folic acid distribution, take home ration distribution, deworming of children. It's a all encompassing mHealth platform. And as on date itself, because of size of the country, it is the largest mHealth platform on planet.
So it is equally at the state level, almost all the states are following, or we have some challenges to face, if you talk about in terms of reaching out, what are the major challenges we have?
I had left the ministry on 17th May. That time Orissa and West Bengal had not onboarded for the reasons you know. Okay. And I think efforts are being made to onboard Orissa now, and West Bengal also come through, but it's pan-India program. Okay. When I left places like Mizoram and Dadar Nagar Haveli, yes, they were using a smartphone. Punjab had not begun, but Mizoram had started. Yes. You can imagine, it's the question of taking interest. And 5 lakh plus is not a small number. Of course, they are targeting to reach everybody by March next year.
So the digitization has helped you in a great way, taking this program far wide reach across India.
I said it's a service delivery tool. There are about 17 key components of supplies and action and activities. A lady used to fill in 11 register, the Anganwadi worker. Yes. And she has to also feed the children and teach them also. Those 11 register on average weighed about 8.2 kgs have been replaced with a 170 gram mobile phone. And then you can just see that what you have to do. Yes. Taking attendance, to feeding children, to giving vaccination, to weighing the children, taking their height and weight, and everything is done by the system. Once you put in simple data, whole thing is calculated automatically by the system only.
Dr. Rajesh, such an initiative at the ground level, India as an emerging nation, a lot of countries in Africa, in Asia, who is also the least developed nation, they're looking for such model. Can we replicate such model across?
Very good question, very good question. This project was also funded by World Bank. It has a World Bank support. So you know how these multilateral also want to take the brownie that we have helped the country, but India has its own talent. So we had a lighthouse event in which about, I think it was sometimes in February this year, I'm a little bit mixing up. The Lighthouse India was basically to showcase the Poshan Abhiyan and the ICDS mobile application, ICDS Common Application Software. We had countries like Mexico and Brazil and some African countries, Laos, Cambodia, about 14 countries came, out of which about 10 to 11 expressed the desire to replicate this system tailored to their requirement and administrative machinery. Very recently, I was invited by an NGO, Grow Great campaign in South Africa, and the First Lady herself came, and during the break she said, can you help me to replicate this system in South Africa? They have 65,000 health workers. So I say, if your government takes up with our government, I think the government will be open to. So you are very right. We also have our cooperation through Bill and Melinda Gates Foundation. So when we signed the memorandum of cooperation, there is a global access clause. The Gates Foundation wanted that. They want to take the same system to other countries if succeeds in India. So it has succeeded. So there are a lot of takers for that.